Hoffa and welcome back for many of you. Thank you so much for joining us this afternoon. I hope you've had time to grab a quick lunch. Our proclamation signing this afternoon is for November as Guam Lung Cancer and Tobacco Cessation Awareness Month. Of course, though, before we begin, I do want to recognize the presence of our acting governor, Joshua F. Tenorio. And acting governor, I do want you to know those open seats are actually for Senator Sabrina Salas-Metanani and Senator Therese Turla, who have confirmed their attendance. They will be joining us. Okay, yes, Amanda, let's just go ahead. Let's give them a round of applause. They're probably looking for parking. I do want to recognize from the Department of Public Health and Social Services our acting director, Peter John. Let's give him a round of applause. Peter John Camacho, as well as our deputy director and former Senator Amanda Shelton. Esther Guidzu, she is here. I want to recognize Guam radiology consultants, Dr. Nathaniel Berg, joining us and his team. Can't miss him with the matching blue shirts. He's with Mossy. Also want to recognize the Guam Memorial Hospital Authority. Let's give them a round of applause. Yes. Oh, and back to Guam radiology consultants. I also want to recognize Isaac Berg, general manager, and all our other staff. Let's give them a round of applause. Also, Guam Regional Medical City, Hoffa Day again, and welcome back to the Office of the Governor. Let's give them a round of applause. The Non-Communicable Disease Consortium Tobacco Control Action Team. Let's give them a round of applause. Also, Guam Behavioral Health and Wellness Center. The University of Guam Guam Cancer Registry joining us, Hoffa Day. Thrive Coalition, WestCare, Hoffa Day. Also, Behavioral Risk Factor Surveillance System Program. Keep the applause coming. Almost done. Guam Comprehensive Cancer Control Program. The Guam Breast and Cervical Cancer Early Detection Program. The Guam Hypertension and Prevention Control Project. The Northern and Southern Regional Community Health Centers. I also wanted to recognize for the Guam Council of Women's Clubs, President Annie Soto, Hoffa Day. Also, I don't think they're related. Patrick Soto, Department of Public Health and Social Services Territorial Epidemiologist. And last but not least, I want to recognize my friend and Togi survivor, Saxon Gayo. And let's proceed to our program this afternoon with remarks from our director for the Department of Public Health and Social Services. Amanda, take it away.
Thank you, Crystal. Buenas and Hoffa Day, everyone. Acting Governor Tenorio. Today we gather to proclaim November as Lung Cancer and Tobacco Use Cessation Month. This is not just a ceremonial observance. It's a solemn reminder that lung cancer remains the leading cause of cancer deaths on Guam. But it's also a reminder that we have the power to save lives. With early detection through annual lung cancer screening starting at the age of 50, for those with a 20-pack year smoking history, lives can be spared. This expanded guidance means more of our people are eligible for screening, and more lives can be saved. A simple low-dose CT scan can find cancer in its earliest, most treatable stages. This message is especially personal for me. Lung cancer is not just a statistic. It's something my family has lived through. My father fought a hard battle against lung cancer. He went through rounds of chemotherapy and radiation with courage and strength, but in the end, we still lost him. He often spoke about how much he regretted smoking for so many years, not realizing that those choices would one day take precious time away from our family. He was proud that he was able to quit nearly 10 years before his diagnosis, but even then, he knew the damage had already been done. His story reminds me every day that tobacco use is not just a bad habit. It's a life-altering addiction with devastating consequences. Over the years, Guam has worked hard to reduce tobacco use, and we have seen progress. Studies show that cigarette smoking among youth has declined steadily over the past 20 years. Guam even became the second U.S. jurisdiction after Hawaii to prohibit the sale of tobacco products to anyone under 21. That was a major milestone, and we believed we were winning the fight to protect our youth. But the commercial tobacco industry has found new ways to target them. The industry shifted its strategy, flooding the market with candy-flavored vape products. Nearly 20,000 flavors designed to hook a new generation. Flavors like bubblegum, berry fruits, and tropical blends are not made for adults. They are crafted to lure children into addiction. And here's the truth we cannot ignore. Young people get addicted to nicotine faster and more deeply than adults. Nicotine changes the developing brain, impairing memory, learning, and impulse control. If we stay silent, we allow an industry to rewire the minds of our children. That's why prevention, cessation, and enforcement must remain at the heart of our work. We must protect our children, support those who want to quit, and ensure that tobacco use is no longer passed from one generation to the next. At the same time, we must confront the reality that tobacco continues to fuel lung cancer and other chronic diseases. Screening and quitting are two of the most powerful tools we have, but they only work if we use them. So today, I urge everyone, healthcare providers alike, to talk with patients about screening. Urge your family members, encourage loved ones who qualify to get tested, and we call on our community to stand with survivors, to support those trying to quit, and to raise our voices in favor of policies that put health over tobacco. Together we can save lives. Together we can reduce the suffering caused by lung cancer. And together we can build a healthier, tobacco-free Guam.
Thank you, Deputy Director. I now want to give the floor to Maria Manuel from the Guam Cancer Registry to provide us some lung cancer data.
Thank you. Hafaday, everyone, again, Acting Governor, and colleagues and everyone, family, friends, and survivors. Thank you to the coordinators for inviting the registry to speak on lung cancer on Guam. My name is Maria Manuel, and I will be speaking on behalf of the Guam Cancer Registry today. For over a decade, lung cancer has been one of the top 5 cancers in Guam. During 2018 to 2020, a total of 197 lung and bronchus cancer cases were reported, and the data showed that it was the second most common cancer in Guam, accounting for 16.5% of all cancers. In men, lung cancer accounted for 20%, and for women it accounted for 11%. Since 2020, it was the leading cause of cancer death in men and women. The Guam death rate for lung cancer is 46.9, which is higher than the U.S. death rate at 40.2 respectively. According to the 2018 to 2020 data, there has been a 6% increase in new lung cancer cases, with the top 3 ethnic groups most affected are Micronesians, Chamorros, and Caucasians. Most lung cancers in Guam are diagnosed at age 55 and older, while in the U.S. most are diagnosed at age 65 and older. It is widely known that tobacco plays a big part in lung cancer, whether you are actively using or buy secondhand. Tobacco also plays a part in other cancers. About 58% of all adult cancers in Guam are tobacco-related. If you or someone you know is a long-time tobacco user, please get screened. As we have said before, screening saves lives. I'd like to thank my colleagues, our community partners, Acting Governor, and Legislature for your continued support. For more information on cancer in Guam, you can visit our website at www.uog.edu/research/Guam-cancer-registry. Thank you.
Sis Moss, Maria. I actually now want to give the floor to Mr. Saxon Gaia. I'm so sorry, mates, and I misdirected you. Saxon is our survivor.
Thank you so much for inviting me, Crystal. Thank you for allowing me to speak about my recovery. My name is Saxon Gaio, and I am 60 years old. I am a lung cancer survivor and also a domestic violence survivor. And I've been sober for 8 years, clean and sober. Thank you. I work for Togi Guam as a certified peer support specialist and also a sexual assault survivor. My father died of lung cancer. He was 69 years old. I became his provider. I quit my job is because I had to take care of him. Taking care of him was something that not my responsibility. I took him to his treatment. I took care of him. I also bathed him, showered him, feed him. He wasn't able to do anything but just wanted to die. The treatment was too late for him. So the doctor told me to take him home and be with him for the rest of his life. My father died. He was only 69 years old for smoking. My mother died of colon cancer. She was 79 years old. So the trauma that I have to go through each and every day is same thing. I have to quit my job and be with my mom day and night. I showered her, I took care of her, I fed her. There was no early detection for my parents. It was just all of a sudden it hit them. So the trauma throughout my life was all about cancer. I started smoking when I was 15 years old. 2 packs a day. I've been smoking for 36 years. I tried the patch, I tried the gum, and I tried cold turkey. I quit smoking in 2022. A year later, I was diagnosed with first stage cancer. It was 0.8 centimeter. It was the size of the pea. My doctor sat me down and talked to me about treatment. I didn't understand it at all. It's because the fact that it was just a lot of trauma that was going on with my mom or my dad. I went home. My husband said to me, "How was your appointment?" I said everything was fine. When he looked at the paper, he said, "You have first stage cancer." That's when it struck me. The doctor recommended me to have an open surgery to the Philippines just to take a small portion of my lungs. But the effect after will be so tremendous. I had decided not to do it at all. I have seen Dr. Berg, thank you, at your office, and you recommended me to go to GRMC. I did a stereotactic ablative body radiation, and I have 5 treatments. The side effect was nothing at all. I went to work right after my treatment. I can eat whatever I want to eat. I can go on and move on with my life. Thank you for showing me the path to my recovery. Early detection is the key. My parents didn't have that. But today, I did. I want to thank Dr. Lisa Flores, who always tells me, go get tested because your parents has been diagnosed with cancer. To Andrew Chang at GRMC, to Dr. Berg, to Divina Lohana Guam Behavioral, I can say today that I am a cancer-free survivor. Thank you so much.
Thank you so much, Saxon. And I want to give the floor to our acting governor for his remarks.
Thank you very much. Welcome to Adelup. It was such a heartfelt story. I was really amazed and so proud that you were able to overcome all of these challenges in your life. Dr. Berg, I heard about your clinic earlier today, and I know that there are other health providers that are here that do all sorts of interventions, and it is so positive and such a good sign that we have on-island resources and expertise that can come into play for our people that are being diagnosed. And as everybody talked about, early detection is one issue or is one important area, but prevention is the best. And the prevention efforts that are occurring, especially with our younger people in society, are so critical. We are seeing a large, rampant consumption of vape products throughout the school system. When I've talked to classes, and I like to engage, and I always ask, do you know anybody who is vaping in school? People would be surprised to see how many hands come up. And although the evidence and research are in its infancy in that area, I think based on our track record with these vices, I think we pretty much know that there's a major danger that is occurring. So much that one of our regional neighbors has banned vapes. Palau, the Republic of Palau, does not allow that in their country. Of course, in the United States and its territories, those kinds of things likely have some legal barriers. It just gives us additional resolve to do our work, to spread the word, to work on prevention at all levels, to bring information so that people can get screened. And of course, to have the support structures in our healthcare area, in our community spaces, to provide the comforts and care for all those that are going through this journey. We heard some staggering statistics, but it's statistics I think that we all know. Smoking has been very prevalent here on this island. NCDs are very high, and of course, cancer rates are high. Higher on this island than many communities throughout the country, and in many communities throughout the world. So we have a big job ahead of us. But as you can see around the room, we do have an army here that is helping us try to reach as many people as we can. And so for that, I want to thank everybody that is part of this movement today. We are providing the public and the community with some very good information. It gives us the foundation to go out there and spread the word, but also to recruit people to help us with these efforts. So count on our support. To the medical providers, thank you very much for the humanity, but really for the expertise and the dedication that you have shown our people. For people, for all those in the community and public health and all the various programs, I know that there is a lot of outreach happening, and we're looking forward to continuing that outreach. And when we heard the number one ethnic group that is plagued with lung cancer are the Micronesian population. Let's remember that there's an access to health care, in particular with that population. Many of that population were not familiar, did not have access to regular health care. And for many of them, it's very foreign. So one of the other things we do is try to reach out to them, to convince them, to show them that there is help for them to be comfortable and to trust the great healthcare providers in our health system that we have here on Guam. Sizus Maasi for your attention, and thank you very much for your time.
Thank you, Acting Governor. I'm going to give the microphone to Dr. Berg for the proclamation.
Thank you. I'll take just a couple seconds first. Acting Governor, thank you. Senator Shelton, you said just about everything I wanted, but really, Saxon, I'm proud to have been part of a system that has you here today, right? What you did for your parents is extraordinary, right? And I try always to thank people. Oh, sorry. That's Roy. You can tell him later. But honestly, I think that there's good news in these things, in what we're looking at. The vape is huge. If anybody doesn't think that eventually breathing in really hot vapor with a bunch of chemicals into your lungs when you're a teenager is not going to turn out to be really a bad idea, I mean, I think we all know it's going to turn out to be terrible, but we'll just wait until the statistics are there. But so that's terrible. That's about the worst news. The great news is sitting here, right? Because I think, first of all, thank you for what you did for your parents. I mean, not everybody is so lucky. I'm sorry that you had to go through it, but then also you need to know how everyone here is thinking, what an extraordinary son. So thank you. It makes me proud to be part of this community that's what we do, is take care of our parents. Um, but I want to share some good news. So we brought low-dose lung cancer screening study to Guam in 2016 and struggled really to get acceptance in the community. We're still struggling. But MDX joined us and said, we'll step up and be part of that. Then GRMC came, and now GMH came. And this room is filled with people dedicated to stopping people from dying from lung cancer. I'm so happy to see, because I must say we all each are doing our own thing. My job as with MDX and the same as GMH and GRMC, we're early detection, and then I want to talk a tiny bit about treatment. But now we need to step back as a community and say we're doing an increasingly better and better job of early detection, leading to people getting super early treatment. But we have to do something to get people to quit even more. I'm glad to see the numbers are down, but I want them to be further down, as we all do, right? But I think it's important for people to understand that how crazy effective low-dose lung cancer screening study is. It is, of all studies, pap smears, mammograms, colonoscopy, you name it, you absolutely name it, there's no more effective screening study in preventing people from dying. None. It is the most effective screening study of any study in the history of mankind to prevent people from dying of cancer. And a huge part of it is that when you're at stage 1, thank God, that when you get detected that early, the difference between stage 1 and further stages in lung cancer is dramatic. You can get it cut out, you can get radiation therapy, or as I'll tell you what sometimes we can do, you can get treated in a clinic in 1 day, in 1 hour, versus a later stage lung cancer as you experienced. And I dare say it's probably not possible that everyone in this room has been touched by lung cancer. My grandmother died of emphysema, right? It's a terrible, painful death, right? So it's not just lung cancer. So that we use the findings on the low-dose lung cancer screening study to help people to quit, to show them, okay, you don't have lung cancer, but you have emphysema. But I want to talk about a good news story too, because there's lots of good news right in this room. We had a patient come in for a low-dose lung cancer screening study on a Friday. And on Monday morning, I called him because I know him. And I said, I see a tiny little thing and I want you to come in and let's get a biopsy. And he said, when? And I said, tomorrow. Tomorrow? Tomorrow. Okay. He came in. So Tuesday, he gets his lung biopsy. I called to Hawaii and said, I want the results back. Call me. 3 days later, we got the results back. I called him up. I said, it's an incredibly early lung cancer. What do we do? I said, this can be treated with microwave. Microwave ablation, if you guys don't know, is we can take it's about the inside of a pen, of a ballpoint pen, that little tube in the inside of it. It's about that thick. We can use CT scan to guide the tip into the lung cancer. A little microwave ball heats up, kills the cancer. You pull it out, cancer's gone, patient goes home an hour later in a clinic, right, on Guam. So we get the results on, as I said, on Monday, and did the biopsy on Tuesday, had the results by Thursday or Friday, and the next day did the microwave. So it was within 10 days of the time he got his low-dose lung cancer screening study till he was cured of lung cancer. It's that crazy effective versus my grandmother dying from horrific emphysema and your dad dying from what is a very painful death, unfortunately, right? It's not a fun way to die, right? So we did that, and then I'll add the little humorous part is he gets a call from his primary care doctor, and he says, I need to see you. And he says, okay, I'll come up. And he comes in and he says, I got some very bad news. You have lung cancer. And he said, no, I had lung cancer. I said, what do you mean? I just got the biopsy results. He goes, no, I went in and got treated and it's gone. He goes, well, he's gone. He said, yeah, they poked some poker in there and burned it up. He's like, I need to send you to an oncologist and to a surgeon. He said, for what? I don't have lung cancer. That's a story that has been repeated now 100 times on Guam because we are able to find them when they're tiny. Or radiation, he said, side effects, zero, right? Go home. No surgery, no nothing, no going off island. You get treated here and you go home. You never spend a day in the hospital, right? So if you do it, if you get people to go, it's great. The access to care issue is massive, but we're meeting with more and more with public health to get them to inform people because they'll say, okay, I'll go, and then they don't go. As you probably know, they all think it costs something. And especially the poor will say, oh, I can't make it today. But if we ask them, why can't you make it? Oh, I can't get right. So that's okay. We'll reschedule you. Then you say, you know, it's free. It's free? It's free, right? Because there's no copay, no deductible. And we need to work to make sure that that stays that way no matter what happens with funding for Medicaid, no matter what happens if it gets cut off from some federal thing. Right now, their insurance companies are mandated, but that may change. So we need to mandate that the most effective study that exists, and somebody, I think Senator Shelton said, if you have a loved one, they have to know it's free. It's painless. You don't get an IV. It takes a grand total of 2-3 minutes, maybe, right? Something like that. They lay on the table, zip, done. You get your results. Unfortunately, there's a worldwide shortage of radiologists, so now it takes 3 or 4 days, not the same day. But it really is an extraordinary thing. So yeah, exactly. So we're on our side. We're doing an extraordinary job. I'm incredibly proud to be part of this team of Guam trying to stop our people, it's our own neighbors, our friends, and their relatives from dying from lung cancer. But I want to tell you, we want to be part of the team to start working on prevention, right? Because this is, I mean, we unfortunately do have people who die of lung cancer who never smoked, right? It's lung cancer exists. Just like people don't go in the sun. Still, some people still get skin cancer, but mostly. So it's mostly people who smoke. But if we can stop smoking, we'll prevent maybe 90% plus of all lung cancers. So I'm all on board, right? And I must also say that the governor's office, and which of course includes the acting lieutenant governor, have been unbelievably supportive of our measures, of our efforts to do this, as we can see here. Right? It wouldn't happen if we didn't have support from the legislature and from Adelup. So thank you. And without that, I'll read. But there's good news here, right? We have a lot ways to go, but there's lots of good news too. So thank you. Okay, so now I'll read this long proclamation. Okay, so, and this is Proclamation 2025-105, a proclamation of the governor proclaiming November 2025 as Guam Lung Cancer and Tobacco Use Cessation Awareness Month. Whereas this November marks our island's third observance of Guam Lung Cancer and Tobacco Use Cessation Awareness Month, during which we join lung cancer survivors and their families and health advocates to raise awareness in support of those who are on the journey to become tobacco-free. Whereas lung and bronchus cancer is the leading cause of cancer death on Guam, with tobacco use as a major contributing factor to lung cancer and other cancers. Whereas tobacco-related diseases are linked to many of the top causes of death on the island, including heart disease and stroke. In 2023, the U.S. Centers for Disease Control and Prevention's Behavioral Risk Factor Surveillance System survey showed that the prevalence of smoking on Guam in the adult population remains higher than that in the mainland. We need to change that. With 18% of residents aged 18 and older identified as current smokers, compared to the U.S. average of 12, or 12.1. Daily smoking and use of e-cigarettes are associated with nicotine addiction. Whereas in 2023, the Guam Youth Risk Behavior Survey indicated that the youth cigarette smoking had declined to below 5%, now at 4.9% of high school students and 3.7% of middle school students, which should be zero, but isn't. That current smoking reflects a steady progress in decline since 1995. However, disparities persist among ethnic groups and between male and female youth. Whereas despite these gains, e-cigarette use among Guam's youth is alarmingly high, with nearly 40%, 4 in 10 of high school students and 3 in 10 of middle school students report vaping, and the use rates are higher than those seen in the United States. I guess it should be continental United States. The high prevalence of youth e-cigarette use underscores the need for strong prevention, intervention, and enforcement measures, including regulation of flavored e-cigarette products that appeal to young people. whereas Guam began to see a decline in smoking prevalence starting in 2007, 1 year after the implementation of the Public Law 28-80, also known as the Natasha Protection Act of 2005, Guam's Smoke-Free Public Places Law. The same year, the government of Guam issued a tobacco-free policy for GovGuam. These initiatives were followed by policies that increased tobacco taxes in 2010 and expanded protections under the Natasha Protection Act and raised the age for tobacco, I'm sure it's going to say sale to 21, but I'll get there, sorry. Sales and use to age 21 in 2017. While these efforts reduce smoking rates, the gap between Guam and the U.S. mainland remains. Whereas the University of Guam's Aim Ahead grant will use research to provide insights into lung cancer disparities among Guam's diverse community, helping to save lives through improved screening. Whereas Guam's only public hospital, the Guam Memorial Hospital, was designated last year as an American College of Radiology lung cancer screening center, giving our people access to advanced technology for early detection of lung cancer. And whereas through broad awareness of lung cancer, health organizations across the island can transform lung cancer survival by amplifying the conversation regarding the importance of early detection and treatment. Whereas a community-wide effort on brief tobacco and nicotine intervention, also called BTNI, skills training has equipped individuals to deliver and apply brief advice and support to people ready to quit nicotine and connect participants to appropriate community and medical resources. This training is Guam adapted is a Guam adaptation of the Brief Tobacco Intervention Skills Certificate Program developed by the University of Arizona College of Public Health. Whereas in 2007, the Department of Public Health and Social Services has provided, has provided a toll-free line, the Tobacco-Free Guam Quit Line, offering access to trained coaches 24 hours a day, 7 days a week, along with a free nicotine replacement therapy. This combination of professional counseling and medication gives individuals twice the chance of quitting successfully. Research shows that the quit line support together with NRTs, those are the trainers, the trained technicians rather, significantly increases the likelihood of quitting compared to trying to quit without assistance. Whereas the Guam Behavioral Health and Wellness Center offers in-person psychoeducation and nicotine cessation, it is after all an addiction, which includes brief counseling, motivational interviewing, consideration of diversity and disparities, quit planning, and relapse prevention skills. This program, was developed through the University of Texas MD Anderson Cancer Center and their Certified Tobacco Training Program, accredited by the Council for Tobacco Training Programs. Whereas regular lung cancer screening tests can save lives, the U.S. Preventative Services Task Force, that's the USPSTF, recommends annual lung cancer screening with a low-dose computed tomography, LDCT, they're referred to as, in people who are 50 to 80 years old and have 20-pack-year history smoking. They have a 20-pack-year history of smoking, or they currently smoke cigarettes and have quit within the last 15 years.
Now, therefore, I, Joshua F. Tenorio, Octum Magatlahinguahan, acting governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim November 2025 as Guam Lung Cancer and Tobacco Use Cessation Month. Given under my hand, I cause the great seal of Guam to be affixed here in our capital village of Hagåtña on this 17th day of October in the year of our Lord, Anno Domini 2025, and Viva Guam Lung Cancer and Tobacco Use Cessation Awareness Month.
Breathe again, breathe again.